introducing you to Be Well Solutions, or for those of you that have participated last year, reintroducing you. We have been Goodwill's wellness company for a couple of years now. Now, Be Well Solutions is a physician-owned and operated wellness company, and hopefully, if you're watching this, you've had a chance to attend last year's health fair and meet the staff of Be Well Solutions. We have a number of people who are committed to helping you stay healthy. Our mission is to bring prevention to the employees through wellness services, through screening, and through teaching you the appropriate interventions. Now, our staff is composed of doctors, nurses, registered dietitians, health coaches, and individuals who are really passionate about helping others get and stay healthy. We have experience helping people improve their nutrition, manage their weight, quit smoking, and we really like to consider ourselves experts in promoting long-term behavioral change. Our goals are really simple. Just like any other group of healthcare professionals, we want to reduce the risk of preventable disease, focusing on things that we really have the power to change, things like cancer, cardiovascular disease, heart disease, stroke, diabetes, as well as smoking, stress, depression, and anxiety. We want to help people manage these conditions and, if at all possible, avoid these conditions. Now, if we're able to do that, then the companies who use us or who hire us are going to reap the benefits of healthier employees. That includes helping the employer lower their health care costs, increase their retention. You, the employee, will be hopefully getting sick less often, and if you're happening to still take those sick days, hopefully it's because you're playing hooky and not because you're actually sick. We want to ensure that those of you who might get injured on the job are getting back to your jobs quicker than before, and we really want to make sure that it's clear that you're not confused by any of this. Our focus is really on you, the employee, and the participant, and you have total confidentiality and privacy with regard to your screening results and the information that you are providing to Be Well Solutions. Now, we didn't tell you this, but we have a little quiz for you here, and I want you to think about this question for a second. You know, we spend more money here in the U.S. on healthcare than any other country, which I will tell you is in the trillions of dollars right now. But where do you think that we rank in terms of average lifespan? Now, we'll give you a second to think about this. And reading this question, knowing how much we spend on our healthcare system and knowing that it's supposed to be the best system out there, you'd probably guess that we're in the top 5, right? Well, if you thought that, you'd be wrong. Turns out that we're not doing so well in terms of life expectancy in the U.S., and we've actually fallen to 51st among the world nations, and that's actually below third world countries. This is in terms of life expectancy, and that's despite, again, the fact that we're spending so much money on healthcare. So there's some reasons behind this that we'll get into, but we really want to re-emphasize that any information that we receive from you, the employees and the participants, in terms of your health, stays with us. Your information is totally private and protected and secure. Any personal health information we may acquire remains with us. We're not providing that information to your employer or to the insurance company or even your spouse. This information is 100% confidential unless you give us the permission to share that with someone like a physician. Now, I do want you to know that what your employer will get is a report of what the population looks like as a whole. So while your personal health information will not be disclosed to anybody, the company is going to learn what Goodwill as a whole actually looks like. If you have any questions on that at all, please contact us and we can explain that further. But back to life expectancy. So for a long time, we had thought that people were programmed to get illness based on their genetics, and that was whether or not they got sick was already in their cards. But what we found in the last 25 to 30 years is that lifestyle, the decisions we make surrounding nutrition and exercise and whether or not we use tobacco, has really grown dramatically. And that evidence and information tells us that a lot of the conditions that cause us to have a lot of suffering or to die early are really, really preventable. This slide shows 4 of the leading causes of death in the U.S. today. We're looking at cancer, stroke, heart disease, and diabetes. And what you see here is that nearly 9 out of 10 cases of adult onset diabetes or type 2 diabetes, nearly 8 out of 10 cases of heart disease, and nearly 7 out of 10 cases of cancer and stroke are potentially preventable based on the decisions we make. And that's a really, really powerful message here. I'd safely bet that most of the individuals watching this video know someone who has suffered and potentially even passed away from one of the diseases mentioned here. And 75% of these cases of disease did not have to happen. So we want to bring this education to help people prevent these diseases, to hopefully prevent a good number of the diseases our participants might otherwise get. Now, the problem that we have in America is that we really are smarter than we act. There's a huge gap between what we know about healthy living and what we actually do. I'd even really safely guess that there's a huge number of people who, after getting out of work at about 5 o'clock, you go home, you open the fridge, you grab a cold beverage, maybe it's a beer, you open the cupboard, grab a bag of potato chips, and you sit down on the couch for the night, and that's your night. And we know better than this. We know that's not good for us, but we still choose these behaviors based on how we feel at that moment, not how these actions will actually benefit and or be hazardous to our health down the road. Now, when we argue the case for wellness and the case for preventive care, we're reminded of the quote, "An ounce of prevention is worth a pound of cure." So think about that for a second. Prevention can include things like education, learning how to read food labels, how to prepare a healthier snack, understanding the importance of daily exercise and learning healthy lifestyle changes, and actually doing these things. Cure includes things like using the medical system, including hospital visits, ER visits, surgeries, expensive care. Prevention's easy. It's painless. It's pretty cheap. And really, when you think about this, would you rather make a few strategic changes now to yield those positive outcomes down the road, or take a gamble, wait, see what happens, and pay the price later on? Do you agree that that's a no-brainer? Some of the research we talked to you about in the previous slides focus around lifestyle habits and how we can live if we practice these healthy habits. So this slide here really illustrates the difference in lifespan for people who practice these different lifestyles. And our big deal here is that we're not asking people to make huge changes. We're not asking you to become ultra-marathon running vegans or to take everything in your fridge and throw it all away right now. We're asking for small changes that will yield big results. So if you look here, people who are vegetarian or who live a primarily plant-based lifestyle are going to live about an extra year and a half, or add an extra year and a half onto their lives. People who exercise regularly are going to add about 2.4 years onto their lives. And the interesting thing about these is that they're all additive. So if you want to add an extra 20-plus years on your life, here's the prescription right here. And here's the trick, or it's not a secret, or maybe people think it is, but it's right here. And note that living tobacco-free adds a substantial amount of time onto your life as well. And again, note that some of these are interrelated. So for example, if you exercise regularly, it's likely to level out your blood pressure. It's going to help maintain a normal weight for your height. So by doing small things, you're going to yield big results. Now, this is one of my favorite slides. It always makes me laugh because it really paints a picture for those of you who are thinking about the future. When we talk about preventive care and about wellness, we're not just talking about being healthy right here and right now or feeling healthy right now. We're looking down the road into your golden years. And some of you have a savings account and a retirement plan, and you're already thinking about taking those steps to save for the future. But think about what you're saving for. What's your retirement going to pay for? If you look at the individuals here, each person here is relatively about the same age, and they're living out their lives really, really differently. So when you think about your future and think about your retirement, would you prefer to live those final years like Barb, who's up in the left-hand corner, who's living in assisted living, or like Sophia we've got in the bottom right-hand corner, who looks like she's living independently and really having the time of her life. You know, when you look at it this way, I think the answer is really obvious, and our staff really wants to make sure that we're helping ensure your golden years are lived like Sophia's and really lived any way that you're choosing. So when we talk about wellness and when we talk about risk factors, we make sure that our program really focuses on the things in our lives that we have the power to control and the power to change. Whether we work on these on our own or with a physician or with one of Be Well's health coaches, it's important to identify these risk factors, looking at things like high blood pressure and cholesterol levels and making sure that you're the right weight for your height. Looking at tobacco. Tobacco exposes you to a number of diseases and illnesses that non-users don't have to face. How well you handle the different stressors in your life, because there will be different stressors, and we want to make sure that you're handling them properly. So these are all risk factors that are within your control, and we're here to help you not only identify these risk factors, but truly take the steps to remove them from your life. So first, when we design a program for prevention for somebody, the first step is to learn where you are right now and really allow you to make goals for where you want to be. So we want to assist you in identifying your risk factors, and you can do that in a couple of ways. The first is through a health risk assessment, a short and really simple questionnaire that we'll provide you with. In addition, we'll have you screened. We'll take a look at things like cholesterol numbers, sugar numbers, blood pressure, weight, and BMI. But really getting these numbers isn't enough. You also have to make sure that you are following up on these bad or potentially bad numbers. And for those of you that participated in the screening last year, how many have looked at your numbers and have actually done something about them? So one of the things that we like to remind people of is that it's not just about getting screened. Getting screened is really important, but that's not where it ends. You have to follow up on bad numbers, and you have to make sure that you watch your trends from year to year. So again, for those of you who participated, we'll provide you with your year 1 results, and this year you'll get your year 2 results to compare and see where you're trending. Are your numbers getting better or worse? And if they're getting worse, we really need to make sure that we're taking action. Be Well Solutions will be on site again to provide these screenings, and we'll get into that in a few slides. Now, everyone at Goodwill will receive a letter from Be Well Solutions with information on the wellness program, how to access your personal health portal, and how to fill out the health risk assessment. All of that information will be provided in that letter. You'll go to Be Well Data and sign in right here. We'll very easily ask you to update your password, and then you'll be taken to your home page. Now, this is a secure web portal with your personal information stored online. Once logged in, you will be able to take your health risk assessment. And for those of you that have gone through this already, as a reminder, it's very easy. It takes about 10 minutes to complete. We're going to ask you questions on dietary habits, fitness habits, and program interests. You'll then be able to view your screening results from last year, and once you've done the screening this year, those numbers will be stored on your portal as well. Now again, once you click Health Risk Assessment, you'll see the questions broken down by category. We ask roughly 30 questions, and we're only asking questions about things that we really need to know. We're not asking anything crazy. It's very easy to understand. There's no fluff or anything unnecessary, but this information really helps us learn more about you to ensure that we can customize the program and for you and for your colleagues. So for those of you that participated last year, there will also be an area for feedback so we can make sure that we're making the program better for you. Then, again, after the screening, you'll be able to click, well, you can actually do this before the screening too, but click the link for the biometric results, and you can find that here. And as you can see, all of your results from year to year will be stored on this page. Now, this will help you watch your trends from year to year, which is really one of the key components to healthy aging. For those of you that are able to attend the on-site fair, which we really, really highly recommend, they're very well operated and they offer a wealth of information. But these will be on-site on April 30th and May 1st. Now there will be 2 locations for the fairs, one in Cleveland at the Holiday Inn in Independence and one in Canton at the headquarters on both days, on both April 30th and May 1st. Transportation will be provided by Goodwill, and you will have the opportunity to get screened. You'll receive your results booklet with this year's, and if you participated last year's information, you'll get an opportunity to eat a healthy breakfast, and I apologize, but that does not include donuts. And then you'll sit down with a healthcare professional to go over not only what your biometric numbers are, but what they actually mean and what your risk factors might be. Now, if you will be attending the health fair, and again, we hope that you do, for those of you that are not diabetic, we really, really ask that you fast. Fasting means nothing but water. That means no coffee in the morning, especially no sugar in your coffee. And we really ask everyone to fast to guarantee that we're getting the most accurate results from you. Now, if you're unable to attend the screening and or would prefer to go to your doctor, there are forms available through HR or on your web portal that you can print off and take to your doctor's office. You can find that here. And this is another view of the home page and where you'd find those screening forms. Now, once we have the health risk assessment and the biometric screening results, we design a customized program for you and for your colleagues. We'll work with Goodwill leadership to come up with strategies to promote health in the workplace. That can include on-site presentations where we can teach you strategies to be a better grocery shopper, or how to eat better in the fast food lane, how to manage stress in the workplace, and so on. We'll offer wellness campaigns aimed at healthy or helping people develop healthy habits, health coaches, which are available to all Goodwill employees free of charge, and they're really devoted to helping people change. You may receive letters from us in the mail, and if you do, we'd really love if you followed up with a phone call to Be Well. We're very interested in developing relationships with you in the interest of health. Now, we already mentioned your personal health portal, and we'll show you a little more of the features in a couple of slides. Our on-site presentations include a lot of different health-related topics. Again, on the health risk assessment, we're going to ask what type of topics you'd be interested in hearing about. These presentations offer a ton of information, but they're presented in a very nice, lighthearted way. We make them as interactive as possible, and the participants are able to get a tremendous amount of information from these presentations, and we really encourage you to attend. Now, the wellness campaigns can include a lot of different things like weight loss or weight management campaigns, fitness challenges, fill up on fiber, where you learn how to reduce your risk of different things like colon cancer, heart disease, and diabetes through eating an appropriate diet filled with healthy fiber or more fiber. And then again, we mentioned the health coaches, but they are a wonderful free resource for you. Again, every Goodwill employee has an opportunity to work an unlimited amount of times with a wellness coach, and we strongly encourage you to reach out to the coaches even just once, whether you have no idea how to start a fitness program or you want information on how to train for a marathon. I mean, really, it covers the gamut, but they have a wealth of information. They're all certified, and they understand goal-directed behavioral changes. Now, we offer a tremendous amount of web-based resources for participants, and these resources are updated often to give the participants the most current relevant information. On the portal, you're able to schedule an appointment with a wellness coach. Under My Resources, we offer a number of different things. We mentioned the screening forms we found here. We also have an area where you can make specific health goals. Go through the strategies to make a SMART goal. You can store your medical records electronically. You can read old newsletters. A video library where videos will be posted for you, including web-based tools, which include different apps to track a ton of different things like tracking exercise, counting calories, managing stress, healthy recipes, that kind of thing. Now, the web portal is available on a computer, it's available on a tablet, and on a smartphone. All of these different resources available are all available on all three of those, and the apps can be downloaded directly to your tablet or to your smartphone. And then lastly, there's My Messages. We use this last area to publish messages specific to the employees of Goodwill. It'll also remind you to do things like complete your health risk assessment. Now, here is where you really need to pay attention. Goodwill is not only providing this program to you free of charge, but they're taking it a step further and really investing in you. So in addition to everything that's been talked about thus far, which again is 100% free, Goodwill is offering $10 cash and a free portion plate just for attending the biometrics. So if you come to the fair on April 30th or May 1st, you will receive $10 and a portion plate. And if you complete both the health risk assessment and the biometric screening, your name will be thrown into a raffle, and you'll be eligible for a variety of different prizes, which includes a Wii Fit and a Wii Fit board. Now, if you have, again, any questions on the wellness incentives, please contact BeWell or contact HR at Goodwill. Now, I know since this is a webinar, not live, we can't answer any questions because it's taped, but I really, really encourage you to call us or email us with any questions or concerns about the program. We hope to hear from you, and we really look forward to seeing each and every one of you at the health fair. Thank you.